Chris Herndon is a pharmacist who wears many hats.
I'm a professor with the Southern Illinois University School of Pharmacy. I've been a pharmacist for almost 30 years, and currently my clinical practice site is with a family medicine residency program.
There he sees patients who suffer from chronic pain as well as opioid use disorder.
We are being asked to manage their opioid therapy, manage the monitoring for their opioid therapy, screen for use disorders, and if we identify them, then manage the patient accordingly.
On an average day, Chris will see and manage the care for 6 to 8 patients. He says screening for mental health is also a big part of the job.
For those of you who do work around chronic pain management, there's a lot of co-occurring mental health disorders that go along with that. And so as our service has grown over the years, we've begun taking on more of a role in managing pain-related mental health conditions as well.
Chris says a common misconception in pharmacy is that there are only 2 career paths to take: working in a community setting or working in the hospital.
When in fact, it astounds me at just how many job opportunities and how intense a role that some pharmacists actually play in the direct care of the patient, whether it be some of my colleagues that round on inpatient care teams hand in hand with the physicians that are making the treatment decisions on an acutely ill patient, people such as myself that are actually embedded within clinics or health centers that are either consulting on really difficult medication regimens or actually managing difficult medication regimens.
And while the phrase medication expert will always run true for the profession, Chris says it's never been more true than it is today.
As more and more medications come out and they become more complex, our prescriber colleagues are leaning on us much more heavily to help them in actually making decisions about what the care a patient needs might actually look like, depending on all of the different scenarios that might play out.
Chris Herndon, another example of pharmacy redefined.